And welcome back, everyone. Well, this month is Breast Cancer Awareness Month, and each Tuesday we'll be talking about breast cancer, talking with a doctor and survivor. Joining me this afternoon to talk about that, Dr. KXII-TV and Susan Martin. Thank you for being here, both of you.
We're very happy to be here.
So, Doctor, first just tell me in general about breast cancer and what it looks like.
Breast cancer, interestingly enough, it kills about 40,000 women a year in the United States. We have about 180,000 people that are diagnosed with it each year. And predominantly, what we used to think of breast cancer as one lump or a tumor is not what we always see. So in many instances, our patients come into us, they've had an abnormal mammogram, they have a surgery, and after the surgery, they come to us and we have what is called a pathology report. And that predominantly tells the physician what kind of cancer you're dealing with. If you look at a cancer under a microscope, it looks obviously an abnormal collection of cells that predominantly do not respect your physiology, and they grow as they please. Therefore, they can go anywhere they want. What we usually see as cancer doctors are your run-of-the-mill breast cancer that can happen to any of us, and those are the cancers that we try to avoid as much as possible.
Okay, who is at risk for breast cancer?
The recommendation is that all women after age 40 should have a screening mammogram. A screening mammogram is very simple nowadays. You can get it anywhere, and any physician's office, any hospital can help you with that. The people specifically at risk are all women, because considering that 1 out of 8 women will develop breast cancer, it's an actual statement. Therefore, you right here sitting across from me have a 15 to 16% chance. Now, if you do take hormonal replacement therapy, such as Premarin, after menopause, you have a higher risk. If you have a first-degree relative, a mother, a sister, an aunt, you have a higher risk. And also, if you become pregnant later in life, there are many other risk factors. And ultimately, genetic predisposition, meaning if you have abnormal alteration in your genes, such as BRCA or BRCA1 and 2 genetic mutation, you're at a higher risk as well.
Okay, so Susan, just tell me, when were you diagnosed and what that process was like for you?
I was diagnosed on August 18th of 2008. I had had a lump removed by Dr. Schrank, and it came back as cancer. And a part of me, I think, always knew it was going to come back that way. But when I actually heard the diagnosis, it's like your whole world just changes in that one instance. I was very lucky because I found out on the 18th of August that I had cancer, and I saw Dr. Isan on the 22nd of August. So I got in very quickly, and he gave me all my options. You know, this is what we have, this is what the tumor is, and everything. He just laid it out there, and we just decided what we were going to do from there.
Awesome. So life is good these days.
It's very good these days.
She's been a cancer survivor now for 14 months. Awesome. So we couldn't ask for any more. What was wonderful about her case is even though it was a cancer that we found it early. So by surgery, radiation therapy, and chemotherapy, we were able to get rid of it entirely, and hopefully you have another 30 years, 40 years without cancer.
Great. Well, thank you both so much for being here.
We're very happy to be here.
We'll be right back.